Gentleman is recognized. Without objection.
Mr. Speaker, in recent floor speeches and in numerous media appearances, some members of Congress continue to repeat the mistaken idea that a significant number of people will die automatically because of lack of access to health insurance. Now, as Franklin Roosevelt said, repetition does not transform a lie into truth. The American people deserve better than this kind of rhetoric. The American people deserve a Congress that can work together to find solutions to our most pressing problems. This argument is based upon a questionable study conducted by biased researchers, inaccurate characterizations, and faulty ideas. And oftentimes these members quote from a Harvard study, which estimates that 45,000 deaths per year in the United States are associated with the lack of health insurance. What they neglected to tell you was that the two authors of this study, Dr. Himmelstein and Dr. Wohlhandler, are co-founders of the Physicians for a National Health Program. And what do they support? This program supports a government-backed, single-payer health coverage. In fact, Dr. Wohlhandler testified before the Energy and Commerce Committee, where I serve on the Health Subcommittee, on June 24th. What did he testify on? On the absolute need, in his opinion, for a single-payer system. So he is totally biased. So this report reflects his demand and his desire for a one-payer system. It's clear that this study was conducted by researchers who knew what they wanted the outcome to show before they even conducted the study. Furthermore, this study used questionable methodology to reach its conclusion. According to an analysis by John Goodman of the National Center for Policy Analysis, the authors of this Harvard study, quote, interviewed the uninsured only once and never saw them again. A decade later, researchers assumed the participants were still uninsured. This is after 10 years, they assumed it. And if they died in the interim, it was because of lack of insurance. It was blamed as one of the causes. Obviously, that's faulty logic. Yet, like unemployed, uninsured happens to many people for short periods of time, it happens to a lot of people. Most people who are uninsured again regain insurance within 1 year. Yet they took and forgot about this statistic. The authors of the study did not track what happened to the insurance status of the subjects over the decade examined, what medical care they received, or even the causes of their death. How can they make those claims? In Massachusetts, for example, the public option here in Congress is patterned after Massachusetts. Now, it has the highest percentage of its residents insured in the United States at almost 97%. We can see the effects of a government-run healthcare system by looking at Massachusetts. According to a 2009 survey by Merritt, Hawkins and Associates, there is a 63-day wait to see a family medical doctor in Boston, the longest of the 15 cities surveyed. This long wait is in large part due to Massachusetts' healthcare initiative. So instead of waiting over 2 months to see a doctor, patients are flooding the emergency room since they cannot find a doctor. And this is putting a major strain on already overburdened and crowded emergency rooms. Obviously, these supporters of the public option here in Congress don't tell you how many people would die waiting for a medical doctor. Now, the United States has the best health care in the world, especially in comparison to countries that have a one-payer system. In 10 of 16 specific cancers, American patients had statistically better outcomes than their European counterparts. A new report released found that up to 15,000 lives could be saved every year if patients in Britain's National Health Service received the same type of quality care that patients in the United States receive. British government responded by saying that it's going to give patients a right to see a cancer specialist within 2 weeks of diagnosis. I could go on. There are horror stories all around this world from countries that are practicing socialized medicine. From 2001 to 2003, the British health system would only allow doctors to prescribe a treatment to preserve vision for those suffering from age-related macular degeneration after the patient had lost vision in one eye. Only after they lost one eye. A woman with epilepsy in the United Kingdom faced a 56-week wait to see a doctor. Also in the United Kingdom, Christine Pruth, 72 years of age, was told she was too old to receive treatment for a head injury at a 24-hour walk-in center. While walking in, she tripped and fell on the pavement. Bleeding from the head, the nurse said she was not able to receive full treatment because she was over 65 years of age and her complaint was a head injury. We need to support health care reform that provides greater access to private insurance, lower costs, and allows people who like their insurance to keep it. The public option does not allow that. Unfortunately, Democrats believe that the government-run health care system, spending over $1 trillion, will solve the problem. The facts in all socialized countries do not bear that out. The numbers just don't add up, and future generations will be on the hook for paying for this dangerous Democrat health care experiment.
Under the Speaker's announced policy of January 6, 2000.